Hi there, this is a 425 Human Sexuality infomercial that presents to you Anal Stimulation, brought to you by Araceli Contreras. So, anal activities can be seen as a taboo, and people can feel nervous and insecure about this activity because some are just not sure about what to expect, and some are just worried about that they will be judged by others for wanting to explore. And there's also an perception that anal activities are homosexual activities. However, anal activities can be heterosexual activities as well. In fact, an article done by HubHut showed that 36% of heterosexual women and 44% of heterosexual men admitted to participating in anal sex. Overall, research has found that for the overall population, about 20 to 50% have participated in anal activities. So anal activities can be a give and receive anal stimulation by both male and female partners. Overall, anal sex and stimulation is an activity that all can explore. So what are anal activities exactly? Well, anal activities can include anal intercourse, which is the penetration and thrusting of a partner's penis in the anus of other. And then there's also anal stimulation, which can be the use of oral to anal contact and manual stimulation. So stimulation for a male can occur by the brushing or rubbing against the prostate through the anal walls, which can then produce a pleasurable sensation and even lead to an orgasm. For a female stimulation, it is caused by the nerves such as the pudendal nerve that branches from the clitoris to the vaginal walls that then has a shared connection to the anus. And this leads to the pleasurable sensations and the potential orgasm as well. So today, social norms of anal stimulation includes the use of your fingers, oral to anal contact, penetration with a penis, and the use of sex toys such as a dildo. However, there are a few precautions that should be taken into consideration when considering anal intercourse. 1. The anus lacks the natural lubrication that the vagina has, so penetration can tear the tissue inside the anus, following bacteria and viruses to enter the bloodstream. 2. The tissue inside the anus is not as well protected as the skin outside the anus. Our external tissue has layers of dead cells that serve as a protective barrier against infection. And 3, the anus was designed to hold in feces. The anus is surrounded with a ring-like muscle called the anal sphincter, which tightens after we produce a feces, and it can actually be weakened with repeated anal sex, which can make it difficult to hold in your feces. And 4, the anus is full of bacteria, so bacteria can normally potentially infect a giving partner. So a few tips for increasing anal sex safety would be 1. Avoid double dipping. In order to minimize the risk of infection, always wash your hands and genitals with soap before engaging in any other sexual activities. So maybe put on a new condom or use a dental dam for any oral activities as well. And 2, you would want to use plenty of lubricant to reduce the risk of tissue tears, since the rectum is a delicate tissue, prone to small tears. And 3, you want to make sure that you're relaxed prior to any insertion, so start out small and slow. And 4, if there's any uncomfortable sensation or pain, you want to stop. And lastly, if you see anything or experience anything abnormal around the anus, see any sores or discharge, you want to see your doctor as soon as possible. So lastly, as a conclusion, practice safe sex in order to enhance your experience. Thank you for watching, and stay curious.